Hello. The kind of line of work that I want to go into is nursing, particularly in a hospital, and some instances or examples of when I think I would use public speaking in this line of work would be communicating patient diagnoses and care to the patient as well as their family, and communicating the condition or state of a patient to their families, and in meetings that may be held at the hospital in which I would be working at. Who would be in the audience? Like I mentioned, the patient could be in the audience, their families, colleagues, my bosses, if it were a meeting setting. And on a typical occasion, I would say that there would only be a few people present in instances where I would be public speaking, because nurses, the kind of nurse I'm planning to be, I wouldn't be giving like a big speech in front of a huge audience. It would only be a couple of people at a time. Like if I were to be in a meeting, that would only be a few people. If I would be talking to a patient's family, there wouldn't be I doubt there would be over like 10 people there, probably like 3 or 4. And when I'm public speaking, it would most likely be in person in a hospital setting, since that is where I'm planning to work as a nurse. And characteristics of my audience, I would say that the characteristics of my audience could depend, especially on the state of the patient. If the patient is in a more critical condition, then I would have to keep in mind how me communicating that critical condition to the patient's families could affect them. And I had to keep in mind that they could be in a more fragile state depending on the news that I would give them, or even the patient as well, communicating their care, their diagnoses to them. I would have to keep in mind how that would affect them mentally, and what kind of state they could be in mentally as well as physically. So yeah, I would say that the characteristics of my audience could depend, but that's it.